Trypanosomiasis, or African sleeping sickness, by Adriana, Tessa, Tendo, and Maddie. Transmission. The disease occurs in Western and Eastern Africa. Around 7,000 people are infected annually. Animals are the primary reservoir of infection. Cattle have been assumed as carriers for the spread of disease to new areas, starting local outbreaks. A wild animal reservoir is thought to be responsible for sporadic transmission to hunters and tourists. The disease is mostly transmitted through the bite of an infected tsetse fly, but there are other ways in which people are infected. There's mother-to-child infection, where the trypanosome can cross the placenta and infect the fetus, or mechanical transmission through other blood-sucking insects. However, it is difficult to assess its epidemiological impact. Pathology. The parasite is transmitted through the tsetse fly. In a similar way, malaria is transmitted through mosquitoes. The damage is inflicted on the red blood cells, which transport oxygen and nutrients throughout the body. The East African cycle lasts for 1 to 3 weeks, and symptoms are visible after 1 day. The West African cycle lasts for 1 to 3 years, and the first symptoms are visible after 1 to 3 weeks. When the tsetse fly sucks blood from humans, the single-celled eukaryotic killer, trypanosoma, is released into the bloodstream. Inside the body, the parasite divides and elongates. They use their flagella to swim through the bloodstream, and each individual trypanosoma parasite is armed with a shield of proteins. In the bloodstream, the white blood cells recognize the foreign proteins and build up antibodies to attack the parasite. However, trypanosoma can change their protein coat of armor, rendering the blood's antibodies useless. This leaves them free to reproduce and damage the body's red blood cells. The trypanosomes feed off the glucose that is supposed to go to the cells, so the body isn't getting enough energy as it needs, which makes the host sleepy. The host is starved of nutrients, goes into a coma, and normally dies. Response and treatment. The immune system tries to eradicate the pathogen by causing a fever and spiking the temperature of the body to denature the bacteria. The treatment relies on what stage the disease the person is in, either the first stage, the hemolymphatic stage, or the second stage, the meningoencephalic stage, of the West or Eastern African sickness. In the Western African sleeping sickness, in the first stage of treatment, pentamidine is used as a main drug. Suramin is also effective, but can cause severe adverse reactions in cases where the patient can receive river blindness. In the second stage of treatment, eflornithine is administered 4 times a day for 2 weeks. It is highly effective but difficult to administer. Thus, doctors will mix eflornithine and nifurtimox to create a diluted solution. In East African sleeping sickness, the first stage is when suramin is used, although suramin can cause adverse reactions and are usually mild and reversible when treatment is stopped. In the second stage of treatment, merosoprol is currently the drug available, but adverse reactions to this treatment can be severe and life-threatening to patients, resulting in a fertility rate of approximately 50%. Public health implications. There is no vaccine or drug for prophylaxis against African trypanosomiasis. Preventative measures are aimed at minimizing the contact between humans and tsetse flies, and local residents are usually aware of the areas that are heavily infested and can provide advice about places to avoid. In terms of preventative measures against the tsetse flies, we advise bug spray, mosquito nets for beds, long-sleeve clothing for medium weight and neutral colors, and avoiding bushes. And we would like to say, if the tsetse fly is a threat, unless you sleep under a net.